Hi everyone, I'm Dr. Gauri Apte, and today we're going to talk about pregnancy and COVID-19. Now, a lot of us have reached a point of COVID fatigue, meaning that we're sick of being stuck at home, of constantly having to wash our hands, and of constantly having to wear a mask. Unfortunately, COVID is still very much here. In fact, we're experiencing some of the highest rates of hospitalizations and of infections world over. So, what does this mean for pregnant women? Pregnancy is what we consider an immunocompromised state, which means that your body's natural ability to fight infections is lower during pregnancy, especially early pregnancy, in order to allow for the embryo to implant and for the fetus to grow. This makes pregnant women more susceptible to infections, and it also makes them more likely to develop serious complications from some of the common infections, such as even the flu. The thing with COVID-19 is that in terms of research, it's a new disease. We usually study diseases over years and years to know how exactly they're going to act or react down the line. With COVID-19, we just don't have enough data to be able to tell what, if any, are going to be the long-term complications of COVID and what it's going to look like 5, 10, 15 years from now. There are so many women that have gotten pregnant during this pandemic that are yet to give birth. So we just don't have enough data to completely understand how COVID-19 is going to affect birth outcomes. Based on the information that we do have, we know that while pregnant women are not more likely to get infected with COVID-19, once they do get infected, they're more likely to experience severe symptoms, require hospitalizations, require intensive care or ventilator support. All of this unknown can lull us into a false sense of security about this infection, but instead, what it should do is make us more cautious. The best thing you can do as a pregnant person right now is to protect yourself from getting infected. In order to do so, you should wash your hands frequently and thoroughly. You should make sure you wear a mask whenever you step out of your home or whenever you're around someone that's not a part of your immediate household. You also need to socially distance from anyone that's not a part of your immediate household. And in situations where socially distancing is not possible, you need to wear your mask properly and try and keep the amount of time you interact to a minimum. For women that might live with healthcare workers or live with someone that's in a profession which increases their risk for exposure, you need to socially distance even from them whenever possible and wear a mask around them as well. So this is what you can do to protect yourself from getting infected. But what if you feel like you have been infected or you're experiencing some symptoms of COVID-19? The first thing you need to do in this case is call your doctor's office. This can be either your OBGYN or it could be your family physician, and let them guide you with what the next steps need to be for you. So this could either mean going in for an in-person visit and testing, or it could mean isolating at home and monitoring your symptoms. My advice to you is don't just show up at a clinic. This is just going to increase your risk for exposure. Instead, talk to your doctor and let them tell you what next steps to take that best suit you. The second thing you need to do is make sure you keep up with all of your prenatal appointments. Your OB office may offer telemedicine appointments, which means you can either get your appointments over phone or via video. But if not, and if they do require you to go in person, make sure you attend all of these appointments. And when you are at the appointment, make sure you do everything to protect yourself. So wear your mask, wash or sanitize your hands. The third thing you need to do is make sure you keep up with all of your pregnancy vaccinations. So it could be the Tdap, the flu vaccine, or any other vaccine that's recommended for you. And the fourth thing that you need to do is make sure you have at least a 30-day supply of any medications that you take regularly in case of emergency. So I just want to say to all the pregnant women out there, don't be overly stressed by this, but do remember that we are in a pandemic, a vaccine is in sight. So this is the time for us to hunker down and do everything to protect you and protect your baby. If you have any other questions, you can leave them in the comment section below. You can also email us at info@fertilihealth.com. And thank you everyone for watching and stay safe.